Next, we will review what to expect on the day of your procedure. Upon your arrival at Millennium, you will be asked to sign in at the front desk and review for accuracy your patient information form. You will be given a name tag to wear during this time at the center. The tag has information about your eyes and must be visible at all times. After any remaining payment issues are addressed, one of our technical staff will meet with you to discuss any last-minute questions that you may have. If you have numerous questions, please contact the center at an earlier date. This will help to avoid delays and ensure that all questions regarding your eyes have been answered to your satisfaction. Although no longer routinely given, an anti-anxiety medication such as Xanax or Valium is available upon request once there are no further questions and all consent forms have been signed. Please do not take these medications if you have remaining questions, since doing so may invalidate your consents and prevent us from proceeding on that day. Following check-in, if it has not been accomplished on a previous visit to the center, 2 sophisticated color images called orb scans and wavefront analysis or aberrometry and any final preoperative measurements will be performed. Your eye care professional or one of our technicians will then escort you to the pre-op area. It is at this time that you will meet your surgeon and discuss any remaining questions that you have regarding the procedure. You will then be escorted to the laser suite where you will spend approximately 10 minutes. Once in the suite, you will be seated in a reclining chair and given a hair bonnet. Your eyelids will be cleansed with a betadine cleaning solution and a piece of tape and a shield will be placed over the eye not being treated. Eye drops are used to numb your eyes. There are no needles or injections. A cushion is inflated to hold your head in place, and the chair is then moved under the laser. After hearing the sounds of the laser during an initial test, your eyelashes are taped and an eyelid holder called the speculum is inserted to prevent blinking. You will next be asked to focus on the blinking light located above you in the opening of the laser. Marks are typically placed on the eye to facilitate the exact repositioning of the flap. In the LASIK procedure, a protective corneal flap is created. This is accomplished with the use of an instrument called a microkeratome and is similar to a carpenter's plane. First, a suction ring is centered on the eye. This creates a firm pressure and in most cases makes the vision gray out completely. The keratome then makes a flap of specific thickness, the pressure is turned off and your vision will return. The entire process takes about 20 seconds. This flap is then lifted to deliver the laser treatment. It will cause your vision to become very blurry. Your job will be to focus on the blinking light even though it will appear blurry. The laser itself makes a rapid tapping noise and most patients will notice an odor similar to a singed hair. This is normal. Typical laser times range from 10 seconds to over 2 minutes depending upon the level of your prescription and the type of procedure that is being performed. Following the treatment, the flap is floated back, carefully realigned and secured in place without the need for stitches. The entire process is then repeated if the other eye is being treated. Patients routinely report feeling more pressure on the second eye. We believe this is due to protective effects of adrenaline during treatment of the first eye. Immediately after the procedure, when you sit up, your vision will probably seem improved but will be very blurry, similar to looking through Vaseline on your glasses. However, visual recovery is rapid and most patients will see well enough to drive the very next day. After leaving the laser suite, you will be escorted into an exam room for a final examination, given your medication bag in exchange for your name badge, and then released to go home. For those patients opting to have their cornea flap created with Intralase, the procedure will be slightly different, since the 2 steps will be performed in different rooms. After meeting with the surgeon, we will bring you into the Intralase suite. There, we will clean and numb your eye with topical anesthetic drops. Each flap creation will take approximately 2 minutes. There is a mild pressure on the eye, which is somewhat less than that with the suction of the microkeratome. Your vision will still gray out. At the end of the procedure, you are able to blink normally, but your vision will be extremely blurry. We will then escort you out of the Intralase suite and ask you to wait about 10 to 15 minutes prior to performing the laser sculpting portion of your procedure. The remainder of the process is identical to what we have previously described.